Good afternoon, everyone. Welcome to the City of Alameda Mayor's Town Hall. I'm Sarah Henry, the city's Public Information Officer. Joining us today to talk about AUSD's plan to reopen elementary schools on March 8th is Jennifer Williams, Vice President of the Alameda Board of Education, Judith Klinger, President of the Alameda Education Association, and Gretchen Hoff-Varner, President of Alameda's PTA Council. Please note that all participants have been muted. To submit a question for the mayor or for any of our speakers, please use the chat feature. All of our town halls are recorded and are available on the city's website and our YouTube channel. I'd now like to turn today's town hall over to Mayor Marilyn Ezzy Ashcraft.
Thank you, Sarah, and good afternoon, everyone, and welcome. Thank you so much for joining us today to discuss this very important topic of potential reopening of our AUSD schools. And what I want to make clear from the very beginning is that I am the mayor of the city of Alameda, and it's a very busy job these days. And we have an Alameda Unified School District. There is no crossover, or there's no control. I have no control over the activities of the district. But what we do try to do as a city is to work very closely with our Alameda Unified School District. It is such an important institution in our city, an employer. Our school children, are educated there, and we have worked hard to provide testing facilities for AUSD personnel, and that's the sort of thing we're doing. We're going to be working closely on vaccinations, trying to get everyone who's eligible vaccinated as soon as possible. That said, cities, at least cities that are not also a city and county that has its own public health department, or the city of Berkeley that does have its own public health department, we're not getting direct allocations of vaccines. So the information and guidance that I can give you about vaccines is not happening right in Alameda yet. But what I do know, don't have control over school district activities. However, my inbox has been filling up in recent weeks with emails from parents, from some teachers. All have concerns. All the concerns are valid. So what I am hoping to do today is just to provide as much accurate, up-to-date, timely information as possible through our three wonderful speakers. I'm very appreciative of you all for joining us today. And Sarah Henry, our amazing public information officer for the city, feel free to interrupt us, or maybe I'll call on you, because there are literally guidances coming out as we speak. I'm told that the CDC just issued some guidelines for school reopenings, and we expect Governor Newsom to make some sort of announcement today. I'm kind of hoping he waits till after my town hall, or maybe he'll text me with a little preview. But until we hear that, I'm going to go ahead and get started, because we want to hear from our subject matter experts. And then we will also want to take your questions, which Sarah Henry will help distribute among the speakers after we've heard from each of them. So we're going to start with our school board vice president, Jen Williams. Jen is starting her second term on the board, and she is also a member of my mayor's COVID-19 vaccine task force. And we're actually meeting a little later today for our second meeting. But with that, welcome, Jen. Thank you so much for being here, and tell us a little bit about what's happening from where you sit on the school board.
Thank you so much, Mayor Ashcraft. I have to first acknowledge the women on this panel. I was thinking about this morning. We're all lawyers, the mayor included, and yet we have chosen a path of public service. And we are committed to the work that needs to happen to take care of our children in this community and to take care of our teachers. And all of you are women that I've worked for a long time with, and I'm just so grateful and have so much respect for all of you. And thank you, Mayor, for this opportunity to talk about a return to school plan. So since basically March of last year, the district's been working really hard to create a safe environment for our kids and staff to return to the classroom. And since that time, there have been a number of different entities, public entities, giving guidance to the district about what a safe return would look like. From the County Department of Public Health, the State Department of Public Health, the County Department of Education, the CDC. And since literally March, everybody has been weighing in on guidelines about what a safe return would look like. And effective January 14th, the California Department of Public Health issued a framework that basically is the controlling document at this time in terms of a safe return. And the district has met all of the requirements in that framework, has been working really hard. And it starts with masking to cohort, safe distancing, ventilation, testing. We just started testing staff this week and students today. So we are moving forward with a testing protocol. We are one of the few districts in the county of Alameda that not only has an opening date, a goal in mind, which is March 8th. The Board of Education approved that date in January, but we've also started testing. So I'm very proud of the work that our district office has put into this effort. We are continuing with negotiations with our labor partners around a safe return. We just reached a tentative agreement with them on small group instruction. I'm thrilled with that agreement, and I hope that all of the teachers and staff support that agreement. But basically, if they do, we can start small group instruction at all of our schools, K through 12, with our most neediest students that will be identified by teachers and taught by teachers. I shouldn't say taught, but in a supervised setting with teachers who volunteer to provide that level of oversight. So this is a step in the right direction. We continue to negotiate with our labor partners about a full reopening plan. And I'm hopeful that we will be able to come to an agreement so that we can, still be able to open our schools at least K through 5th grade, which is what is allowed right now on the purple tier on March 8th. That's our goal. Obviously, moving forward, we want to open programs to our older students. Under the state tier, we can't do that until things improve somewhat more, but that's obviously something that the district is also working on. We're also talking about a robust summer school program to not only address learning loss, but to also give kids a place to go to continue their learning through the summer months. So there's a lot going on. As Mayor Ashcraft indicated, the CDC issued new guidance today. I've been working all morning and haven't had the chance to review them. A quick look didn't look like they're placing a new requirement or any type of new requirements on us in addition to the California framework that we have from the State Department of Public Health. Vaccines is a big issue right now with we're hearing a lot about vaccine requirements and whether or not, from a policy perspective, local jurisdictions should require vaccination of staff before and possibly students before we return to the classroom. The district at this point and the Board of Education in support of the district is not advocating for vaccinations to be a prerequisite to opening our schools to get our kids back in the classroom. Obviously, that's a good mitigation effort to mitigate risk. But we are following very closely to the letter, really, of the California Department of Public Health framework, which at this time is not requiring vaccinations as a condition of reopening. So I remain hopeful that on March 8th, we will have kids back in the classroom. That is my hope. We are also very lucky in Alameda to have a number of pediatricians and pediatric epidemiologists who are also weighing in and talking with our superintendent. And we have doctors at UCSF that are also analyzing the data and looking at how this disease has progressed. And we know a lot more about the disease now than we did in March. And I feel confident, and I know others do, the experts that we're relying on, that we can do this and we can get our children back in the classroom. We know that kids are suffering. We've had an increase in mental health issues in our district, as other districts are across the state of California. So personally, this is something that's very important to me, that we get our kids back in the classroom. It's where they need to be, under the guidance of their teachers who they miss dearly. And I know our teachers are missing our students as well.
Thank you, Jen, for those thoughts. And I'm going to go now to Judith Klinger. Judith is president of the Alameda Education Association, and welcome. And she's going to share with us some of the teachers' perspective.
Yeah, thank you so much. I too am appreciating this opportunity this morning. And Jen Williams and I have a good long-term working relationship. I consider her a friend. And Gretchen and I have just begun working together, but it's very fruitful and very warm. And it gives me hope that we can find the places where we can work together to get us back into the classroom, because that very much is where the teachers want to be. So, you know, from our perspective, where we are is thrilled that we have the small groups MOU, Memorandum of Understanding, negotiated. Teachers are now voting on it. And it's a great way for teachers who want to volunteer to help support kids who are very much at risk with all the safety mitigation protocols in place. So voting is going on now, and the voting window closes exactly in 1 week minus 18 minutes. So we'll know at that point if our small groups MOU has passed, and then we hopefully can get them up and running. AEA leadership is strongly advocating that our members vote in favor of it. And that said, you know, every single member is an individual human being with their own mindset and their own series of questions and queries. And so no predicting exactly what will happen. We also, I want to really affirm to the public how much teachers want to be with the kids and how hard this is on teachers to be doing distance teaching. Many of our teachers are parents, so they feel both sides of the pressure. And I hear some very critical things coming out against teachers, you know, in the national press and on local social media. And it's really heartbreaking. And if I can just take sort of a philosophical moment, you know, when we're in periods of uncertainty, we want to feel like there's something certain. And if we can blame somebody, it lends a sense of control. Well, somebody's in control, and so I'm going to point the finger at them. We all want a piñata, and it's interesting to me that our society at this moment in time is turning two very female groups against each other. The teaching profession is largely women, and the parents who are suffering the most also is the moms. And there's, you know, plenty of reports on that in the newspaper. And I would really ask us all to take a step back and think, what is going on societally that these two groups of females are sort of at each other? And, you know, I think that the obvious answer is that we've had a president for the past 4 years who turned truth into a hall of mirrors. And so people read science, they read data, the data keeps shifting, and we have really gotten into a place of fear. The teachers want to be back and are afraid to be back in large measure. And we hear parents who are also docs come to school board meetings and cite data and say it can be made safe. And you know, we want to believe, but trust has also been damaged very much in the past 4 years. You know, we had the head person in our country flat out lying. And it makes it very hard to build trust. So some parents very kindly offered to have some docs come and talk to us, but our members said, we don't feel like we can trust that particular group. So, not because we don't love our parents, but, you know, there's a natural bias, and trust has been damaged across the past few years. So one thing AEA has done is reached out to an epidemiologist out there in the community. And he graciously has offered to meet with our teachers for an hour next week. Say, here's what the science knows, here's what the science doesn't know, and then take Q&A. And so we're really excited about that opportunity for teachers to hear unvarnished truth, where they don't have to sift through what's out there on the media. Am I reading something that comes from a peer-reviewed medical journal, or am I reading somebody's opinion about what constitutes safety? And so parents, I know that what you want, many of you, not all, is for the schools to be open three weeks ago. And I'd ask you to really hold respect in your hearts for who our teachers are. The folks who come into teaching tend not to be risk takers, entrepreneurial spirits, who want to go drag racing on Highway 880. Folks who come into teaching tend to be fairly risk aversive, very cautious, safety oriented, and we want that. That is who we want in our classrooms, particularly at the younger years, watching our little ones. And along with that comes considerable hesitation around what's going to be safe back in the classroom. So, if the coin is a cautious, safe person, we want that. We have to accept the other side of it too. So the other thing that I want to chime in with and then end on is how much we need our community to work together to keep community rates down. So the more, as we're out on the streets, out and about in our own homes, wearing our masks, keeping our distance, not breaking our social bubbles and having other folks over for dinner, the faster all that happens, the sooner we can open school. Oh, and then there's one more thing, and it is about vaccines. Alameda County, in its wisdom, came up with the most cumbersome, bureaucratic, red tape laden way for teachers to get authorization to get vaccines. So instead of being able to just go to the vaccine site once you've gotten an appointment with your teacher card or a paycheck stub, all the school districts in the county had to upload employee info to the County Office of Education. And then they in turn are going to generate individual letters for all the tens of thousands of teachers in this county, a letter that they then send back to the school districts, and the school districts will disseminate them to all the individuals. All that has to happen before any teacher in this county can get a vaccine. So if we want to put pressure somewhere, the Department of Public Health came up with that grand idea. So pushing on them, pushing on the county supervisors, I think that will make things go a lot faster, because as it stands, teachers aren't going to get vaccines until June. Thank you.
Thank you, Judith, for your words. I'm elated to hear that there is a local epidemiologist who is going to be speaking to teachers next week. I think that's a brilliant idea, and there is nothing like science and facts and having your questions answered that goes a long way toward instilling confidence. I'm just going to interject quickly. I cringed when you just told me about all these requirements for teachers to get documentation to get their vaccines. There's a lot of different information streams out there, and I am not part of the communication loop with the superintendents, but I did have the chance at a meeting just the other night to ask the PIO from our healthcare systems agency in Alameda County about the availability of the Oakland Coliseum megapod that FEMA is setting up next week for teachers. And what she told me was that that they will be following whatever tier our county is in, and that teachers should be able to get their vaccines there, and as early as maybe even now, and Sarah, feel free to chime in if you know more, that myturn.ca.gov, did I get that right?
That's right.
Yeah, is where you go on. Everyone should go onto that site anyway, because it is the statewide database to tell you when your particular category comes up for vaccines, and then even to tell you when there's vaccine availability in your area. And what I was told, and again, Anika Chaudhry was the source, was saying that this is what she understood, and that as early as next week, teachers could possibly even go onto that site and book their appointments for the Coliseum. And again, I don't want to be the bearer of incorrect information, but it is certainly worth looking into. But at the very least, get yourself into the database. They'll send you a text message back confirming that they've received your information, you're in the database. And then I know I've shared with the district some information we got about a clinic, a site in San Leandro that is a place that teachers, the San Leandro Unified School District teachers were getting their vaccines there. So, I always want for anyone in my city, in our city, to have what the neighbors are getting. And so anyway, I'm hoping someone is looking into whether Alameda teachers can also avail themselves of those vaccines. But we'll get back. I know this will come up more in the discussion in the Q&A. But now I want to go next to our third speaker, and this is Gretchen Hoff-Varner. Gretchen is the president of the Alameda PTA Council. So of all the PTAs in the city, this is the umbrella organization over all of them, and she is also the mother of two school age, I think elementary school age children, correct? Yeah, I have to say, this is kind of an example of woman power here. Look at all of us, I'm really, I'm just so impressed with the passion and commitment that all of you are showing to our students and our teachers. So Gretchen, let's hear from you from a parent's perspective.
Yeah, and thank you so much for having me. I feel totally honored to be in this space with all of you. I am the president of the PTA Council of Alameda, but I just want to make clear that I'm only speaking really for myself today. I would never claim to speak on behalf of every PTA in Alameda, much less every parent. But I thought I would start by honoring the fact that this is an incredibly difficult time. It's hard for teachers, and I think Judith really articulately has talked about that at multiple occasions. It's really hard for parents, and it's really especially hard for kids. As a mom, just personally, I know that my kids are suffering in real, meaningful ways, and I see it every single day. But there's a wide variety of challenges for students, and I think particularly of those children who are experiencing pre-existing needs, who the kids who have never successfully logged on to our remote learning program, the kids who have need for special education resources that can't be provided remotely, kids who come at this without safe and secure housing or food security, kids who are in poverty. And I also want to acknowledge that the difficulty of this is in multiple different levels. Some kids are having mental health crises, and others are experiencing social emotional losses. And then there's learning loss, which I think we all know is important, but frankly seems to be the smallest thing compared to the mental health crises that our children are experiencing. So a lot of the conversations about and I think parents are afraid. They are afraid for their kids, and they are afraid for their schools. And I think teachers are afraid too. They're afraid for their health and the health of the people they love. And I just want to pause and say that so many of the conversations about this in the media, in social media, in Alameda, are driven by hurt and pain. And it comes out in the form of anger and sniping and nasty comments. But it's all driven by the fact that we are afraid, and we're living in this global pandemic, and we don't know where this is going to end. And so I think that we can all do a favor to ourselves and our teachers and our schools if we just start with that and acknowledge with empathy that we're all really struggling to try to make this work. I also think that everyone in this conversation, even if they don't get the language right, loves their kids, loves our teachers and educators, loves the school district, and wants to get this right. So, having gone on my small speech about how we should all be kind to each other, one way the district, I think, is getting this right is by offering multiple streams of education depending on family needs. So the district has offered a remote school ever since that they announced that in June of last year. And so there are about 900 kids who are receiving exclusively remote education and who are not going to be expected or even have the choice to return to the classroom. And so that's a great thing for those teachers and those students who are in that program to let them stay at home where their families believe they're safest. There's also distance learning that even if we return to campus, students who want to will be able to stay in a distance learning module. And so no student, as far as I understand, is going to be required to go back to campus. The reopening schools or reopening campuses conversation really is about the students who want to and need to be back in person with other students and with teachers, and whether they will have the ability to make that choice and to go back to campus. And I know that's been really important for parents. And I think it's important for all of us to remember that this is not a universal one-size-fits-all solution. That's also partly why it's so logistically complicated, is because we're meeting many different needs. So Judith, I think, talked really articulately about the trust gap and how teachers who are really, smart, thoughtful people can read the same science that parents read and yet still come to different conclusions. I read the CDC statement and I think, let's go back right now. And I think that, as Judith has pointed out, teachers read that and think, well, that sounds great, but it's dependent on multiple layers and safety protocols. And our district and state have a long history of not getting that right. So why would I believe that they can get it right now when my life is on the line? So that's a pretty heartbreaking trust gap to hear. But I also think it's one that we as a community have a really powerful way to help address. And so I thought I would take this time to talk a little bit about some things that families in the community can do to support this process and to maybe rebuild some trust with our teachers and educators that makes them feel supported as they move forward. So one of these is to observe safety protocols, wash your hands, watch your distance, and wear a mask. The lower the community transmission is, the safer people will feel going back to school. The second is to advocate for teachers to get vaccines, especially to County Public Health and I think to Representative Barbara Lee. My understanding is that vaccines are controlled by County Public Health and by the federal government. And so if you can send an email to your representatives or to Dr. Nicholas Moss or Wilma Chan, who's our county supervisor, that helps to drive political consensus around prioritizing teachers who are going back in person ASAP. And the third idea is a little bit harder, but I want us to start thinking about how we can be communities that care about each other and support each other in going back to school. The schedule is really tough. We could have a whole meeting just about the logistics of trying to send kids back to school for, I think the current plan has elementary school children going back 2 days a week for about 2.5-hour blocks. At staggered drop-off and pickup times. And so if you think about this from the perspective of a working parent, your head kind of wants to explode. So how can we support each other in mitigating some of that friction? Some ideas include things like walking school buses and helping each other by, volunteering as a supervisor on campus to keep an eye on kids as they enter and leave classrooms. Some of these positions are available now and actually can be paid. If you go to EdJoin, you can apply to be a part-time student supervisor. But I think it's also going to require some informal outreach in our communities, and we have to just be willing to support each other, even if it's a little inconvenient for us, so that we can make sure that every kid and every family who needs to be back in class can get back to class. And then finally, The district has received funding to support their safety protocols, and they've invested a ton of money in things like ventilation systems and PPE. As far as I can understand, there's a warehouse of PPE somewhere out there that is ready to go. But I think that we can provide financial support for our classrooms across the island, particularly for things like crayons for kids. You know, a lot of schools handed out all their school supplies at the beginning of the year for kids to take them home. So they'd have crayons and paper to do work in their remote program. You know, we can solve this problem as a community. We can buy crayons for those kids and get those into the classrooms. And that's something where I think Alamedans have been generous for years to our schools. And this is a real tangible need that we as parents can solve. You know, we can't solve a lot of these problems about this vaccine, but we can channel some of this fear and uncertainty into productive action by coming together and really working to do what we can to make it safe for kids and teachers to be back. And I've talked a lot, so I'm going to stop there.
Thank you. Thank you to all three of you. Actually, listening to the three of you talk, I really believe that we can do this. We can find the solutions that we're all looking for, and you are all so eloquent and meet all the various needs and concerns that are out there. So you certainly fill my heart with hope, and also I will agree wholeheartedly with you, Gretchen, that Alameda is a very giving, caring community. You probably know about our Feed Alameda program that is helping our local restaurants stay in business while also helping feed some of our most undernourished residents. And so anything is possible. I think the sky's the limit when it comes to the generosity and compassion of Alamedans. So I certainly have a few questions that popped up just listening to all of you, but I want to check in with Sarah because you're getting questions from our audience. Have we got some questions or?
Yeah, I have a handful of questions, not too many. So if folks want to continue to enter them in,
Sure.
please do. So Mayor, if you want to start or with a couple of, however you'd like.
No, let's start with our audience questions because they may echo some of mine.
Perfect. Okay. So the first question is asking, how can we as a city and school district get Wi-Fi across the city to level the playing field for all students and families?
Who wants to take that? Was that your hand up, Judith, or you were just cheering?
I was merely cheering.
Yeah.
It struck me at the beginning. Island High School was just, they were so frustrated. And we started a conversation about, we've got our own Alameda electrical power company. Why don't we have our own Wi-Fi? That would be such a leveler for our poor kids out in APC. Yeah, I have no solutions, but yes, I think that would be a great thing.
Jen Williams, anything from you?
Yeah,
you unmuted, so you're fair game.
Thank you. This is something that I think we in the district and our city partners need to work on together. I know that in this pandemic, the technology divide in our community with our students has really come to the forefront. Now that we have to have a technology in place for our children to access public education. And so from the very beginning of the pandemic, the district worked really hard to get Chromebooks out to everybody, to get hotspots out to our families. But we do know that there are still families, even with hotspots and extra support, that cannot access distance learning. And this is something that like I said, Mayor Ashcraft, I hope that this is something we can work on moving forward. In order to have the infrastructure in our town, there's still spots in Alameda where, and even on Bay Farm where I live, where internet access is really difficult and spotty at best. So I know the city's putting together a plan in terms of Wi-Fi across the town for many different subsections of our community, and AUSD is part of that. I've attended a couple of those meetings, and I'm hoping that we can continue to work together to make sure that all of our families have access to technology.
Yeah, really, really good point. And you're right, Jen, it is being looked into and addressed, but maybe we need to see what we can do to accelerate that.
Next
What-
question came in for Judith while she was talking about the list that you have to send to the County Office of Education. This person just wanted to clarify or just make sure that the district had already uploaded those teachers' names and had already begun that process.
Yeah, it went in Monday at noon, and then the county office said on Wednesday that they were going to be verifying them on Thursday.
Thursday, yesterday?
Thursday
Judith?
yesterday.
Yesterday. Okay.
Can I add something just really quick?
Please.
Judith, I'm sorry, I didn't mean to cut you off. I just wanted to add that Susan Davis has been working really hard on a vaccine webpage on the school district's website that will be continually updated. Susan, chime in if I miss.
So let me introduce the amazing Susan Davis. She is Sarah's counterpart over at AUSD, the Public Information Officer. What do you know, Susan? Enlighten us.
So we're actually working really hard on figuring out how to communicate vaccination opportunities to our employees. And I was just talking to the PIO of Alameda County Office of Education of how to handle these tips that are coming in about, there's vaccinations available at the Coliseum or at the CVS in Livermore or, at this certain clinic in Albany. And we're trying to figure out when and how we will communicate this to our employees, because the last thing we want to do is send someone out to Livermore and then they get out there and actually they can't get their vaccination. So we did develop a web page where we'll be putting up to-date information. I'm going to send the link for that to Sarah so she can put it up in the chat, and also the vaccine page for the Alameda County Office of Education. So we're aware that people are looking for information, and we're trying to figure out the best way to get accurate and verifiable information out to our staff about it.
Thank you, Susan. And I would just chime in that no one should go out to a site if you don't have a confirmed appointment. Do save yourself the time and trouble of that. But what you should do, and go across all different platforms, the myturn.ca.gov, but also if your healthcare is provided through one of the biggies, Kaiser Permanente, Sutter, Stanford, you can go on to that website, the website of whatever entity it is, and you can again register. There will be questions, so you have to certify whether it's age group or employment category, but get yourself signed up, because that's how you get in the queue. And then the other thing is, it's true that retail pharmacies, CVS and Walgreens, and I think in California, at least in the Bay Area, it's CVS, has gotten their own allocation of vaccines. And so they are scheduling appointments. Go to cvs.com, Sarah?
I'll put it in the chat.
Yeah, thank you. This is the other half of my brain here, the stronger part of my brain. But again, go on to that website. I mean, right now, I think that they're still prioritizing by age category and maybe medical workers. But again, and I'll just quickly segue and say, one of the missions of this COVID-19 vaccine task force that I'm chairing is we want to get all of our vulnerable residents, especially our seniors who might live alone, who might have difficulty going online or sitting on hold on the phone for hours to make a vaccine. We want to help them get vaccinated, because that's when our county then moves to the next tier. But teachers, you are up. And so Susan, like she said, she'll get that information up on the website, and we're going to do everything we can to get you in line. But do the self-help and get yourself registered across all different platforms. And then my only other ask is, once you get that appointment and get your shot, please be sure to cancel any other appointments that you've made so that you free up those vaccines for others. So
Can I add one more thing?
Who is that?
Judith
Susan.
alluded to, Judith alluded to the letters that we'll be getting from the Alameda County Office of Education. We haven't gotten those employment verification letters yet, but Dr. Moss from the County Public Health Department did tell us that it's possible that if you have an appointment, you can bring your AUSD ID badge or a payroll stub, and that will serve as employment verification.
I'd heard that too. Yeah. But so like a photo ID, right? With your, and a payment and a pay stub. Yep. Don't leave home without them.
I'm getting a bunch of questions asking what will be the testing requirements for students and teachers.
Well, that's something I know nothing about. So who wants to dive in here?
I can talk a little bit about it. Susan, correct me if
Please.
I get the details wrong. But basically, the testing requirements vary depending on the tier that we are in. So right now in the purple tier, we are planning a weekly testing rollout. And the district is working really hard with our testing partner, National Labs, to make testing available across the island at a number of different locations for our families to test on a weekly basis. As the spread reduces and we drop into lower tiers, testing then becomes less frequently required. So right now we're on a weekly schedule. Obviously that'll go to a bi-weekly schedule, and then down to monthly, this idea of surveillance testing. So right now, actually we started student testing today at Ruby Bridges. That testing will go through the weekend. And we are seeing how it's going. The district is monitoring that today. I heard this morning that it's going well. So right now the plan is for weekly testing, but like I said, if the numbers continue to drop, so will our testing requirements.
Thank you, Jen. Great.
Great. Next question, this person says that they fully understand the teacher's concern about everybody's safety. Is there a way to think creatively and hold sessions for kids on school grounds in the open air, weather permitting, which can promote that social interaction between their peers, which is what they're missing most?
Who'd like to step in there? Jen, take it away.
I don't want to take over the space, but
Anyone can chime in at any time.
This is something that we talk about at our board meetings for sure. The idea of utilizing our outdoor space. You know, we're lucky in Alameda to have such incredible weather. I think right now the focus is getting our kids back in class in a safe way. But yeah, this is definitely something that we're talking about, and you know, finding ways to utilize our outdoor space once we have an agreement in place with our labor partners and some type of a return back in the picture.
Okay. Gretchen, did I hear? Yeah.
Yeah,
Please.
I was just going to chime in to say, I think this is also a place where we can exercise a little bit of creativity once there is an MOU in place. But for example, I know some PTAs on the island have already reserved big chunks of money to support things like voice amplifiers and clipboards so that teachers can take kids outside and use existing infrastructure but be outdoors instead of inside. It's not fancy. It's not, you know, tents or bubbles or anything, but I do think that there's once we have teachers who are, you know, once we're back on campus, I know teachers are working, so I hate using the term back, but once we're on campus, then I think the sky's the limit in terms of how we can creatively use our space and parent dollars to support reopening. And I just want to also be clear that I think PTAs across the island are invested in supporting kids across the island. So PTAC is very focused on not having, you know, Edison kids be able to have amazing outdoor education while kids at our Title I schools don't. The goal is to provide these kinds of resources across the community in an equitable way, and we're working on it. So that's
Thank you. Thank you for including the equity lens, Gretchen, because that is something that is so important in everything we're talking about: educational opportunity, access to vaccines. And so I do realize that, you know, even on our island, there's considerable divide or just disparity among what PTAs are able to do, or even if a school has a PTA. So I'm glad to know that there's a desire and an effort to make sure that all children will benefit equally. All children and their teachers will benefit equally from these resources. So very good.
I think that
Judith.
Oh, yeah, sorry, go ahead.
Yeah, Judith, go ahead.
I just wanted to add on a little more nuance to the outdoor ed piece, because I think the community member was wondering, well, can't we do outdoor ed while we're waiting for MOUs to get ratified, et cetera? And the thing is, you know, running a school is just so much more complicated than meets the eye. So even if we just have outdoor classes meeting, there's still all the issues of ingress and egress, and who is going to be doing the screening at the gate to make sure that the student has answered that they are symptom negative that day, et cetera. It's how will the kids go to the bathroom in a safe way? So it just is so much more complex than meets the eye. And I think that's what I wanted to say. Thanks.
Thank you. And I will just add, Judith and everyone else who's watching. So our city manager, Eric Levin, and I from time to time have Zoom meetings with superintendent of schools, Pasquale Scuderi, and talk about the various issues and how we can help the school district. And we end the Zoom calls and we look at each other on the screen when Pasquale has left and said, it's more complicated to run a school district than it is to run a city. And trust me, it's plenty complicated to run a city. So lots of moving parts, but I think the answer is maybe outdoor education. And I think Gretchen even said as much. When MOUs are in place, then some creative solutions can be further explored. Fair enough? Okay. Sarah, we've got more questions, I'm sure.
More questions, and we have a hard stop at 1 too for our panelists. But this person just wanted to quickly confirm that families will still have a choice to return to school or stay with distance learning. Yes, so that's confirmed. Great.
I see heads nodding in unison.
Easy one. The next one is asking,
bobbleheads.
how is the mayor helping to support AEA with the MOU negotiations?
Okay, the mayor is not a part of the negotiations. You don't want me in the negotiations, but I'm a huge supporter of teachers and also parents. And I think most of you know, I am a product of Alameda. Yay! I'm a product of Alameda Public Schools, and I have such fond, warm memories of my teachers, Edison, Lincoln, Alameda High. And I was one of those latchkey kids, although I don't think we even locked our doors in those days. And I spent a lot of time hanging out after school with my favorite teachers who let me, erase the chalkboard and help set up bulletin boards and all those good things. So I want the best for our teachers, for our students, for our parents, and really we all do. And when this agreement is reached, it will be mutually beneficial and it will be respectful. And I can tell just listening to the conversation, the tenor of this conversation today, and all the very good-hearted, heartfelt desire to reach the resolution that we are going to. So they don't need me, but I'm going to try to get them vaccinated. That's where I'm working hard.
The next person said that they heard Judith say that the union is voting on the small groups, but they wanted to ask, aren't the small pods already meeting in person?
Okay, Judith, you want to clarify?
Very good question. So there are small pods already going on that are being handled by community groups. They're not being handled by teachers. The small groups are a different critter. That will be if I see that there are some kiddos in my classroom that need some extra help, I can volunteer to have 3 to maybe 8 of them distance come in for some extra support. That's one flavor of what we're doing. Another flavor of the small groups would be for the at-risk kids at my school that all the various people have identified as being at risk. I can volunteer to take 6 to 8-ish of them. It's actually 6 to, we'll just leave it at that. And give them some extra boosting. So it's different from the community-led ones, and important to know, a child cannot be in both one of these teacher-led small groups and one of the pods because that contaminates the cohort.
Great, thank you. Next question is back to about testing. Will the district be getting the results and verifying that the students have tested each week to ensure that anyone with a positive test doesn't go on campus, or is this for the parents to monitor?
I can respond to that.
Ms. Davis, please.
Yes. We are working out the system for notification. So just so the community knows, we have a COVID liaison team that will be analyzing those results, and we will let the parents know as soon as we get the results that the child is not cleared to come onto campus if it's a positive result. So we will definitely be monitoring that for families.
Thanks.
Next is asking, it would be great to have an overview of where exactly the board, AUSD, and the teachers are with the negotiations to open. What is the timeline? I think you talked about that, Judith. I don't know if you want to.
Yeah, go ahead and mute, Judith.
Yeah, thanks. So I'd say we're close. This bargaining has been going on for a while now, and it's very, very work intensive. And that said, you can never say when something's going to be done, because bargaining, if you've never bargained, it's just not like anything you've ever done. And so that's my perspective, is we're close, hopefully soon.
Great. Related to the equity lens that we were talking about earlier, how is the district doing outreach to and getting feedback from folks who are not on Facebook or connected to the PTAs?
Good question. Who wants to take that?
Susan, I'd like you to talk about the survey that we just did and your efforts to reach our hard to reach communities, because Susan's done some amazing work about outreach.
Thank you for that, Jen. Yes, we are very aware that we have community members or families that typically aren't a part of our normal outreach, aren't tuning in on social media, maybe aren't going to Board of Education meetings. And so we do have a newsletter that goes out to all families. And when we did this survey last week, we did a survey to see, just to gauge just generally who wants to come back and who doesn't want to come back. We ended up contacting the principals at schools that had low response rate so that they could reach out personally to these families by doing phone calls. We also worked with our parent liaisons who have close connections with our communities. We did translations, and we asked our translators to reach out to any families that they knew in various language groups so that they could coach people through the importance of doing the survey and what the survey actually meant.
Last question is before we close. Back to you, Susan, about testing. Would a student be clear? Would a student be not cleared to come to campus if they weren't tested?
They will not be cleared to come to campus if they're not tested. So we'll be sending out lots of information to families about how the testing will work, but it's going to be a requirement that your student is tested before they come on campus.
Terrific. I don't know, Mayor, if you want to ask folks to.
I am just going to do a quick little closing and respect everyone's time.
Yeah.
First of all, thank you so much. You were all fabulous. And I hope everyone feels as well informed and more up to the minute as I do, with the caveat that conditions change quickly. I will say this, things are moving in the right direction. There has been a sea change since the new administration took office. And remember, we're not even 1 month into this new administration, but it's been a very action-packed not quite 3.5 weeks. But we're also seeing that even on the vaccine front, we're just getting lots more vaccines into the state, a lot more availability, resources, money is coming in to help us out. So things are going to get better, things are looking up. But in the meantime, you all raised some really important points. This is not a time to be adversarial and to play the blame game. I get it. People want someone to be responsible, the bad person, what have you. That's not the way this is. It's just not true. It's not how things work in this space. We're all doing the best we can. I'm very hopeful that there's agreements that are going to be made and we'll see our schools reopening. I want it to be done safely too. So in the meantime, and I think all of you said this, what you all have in your control and how you can help get our case rate down, get our kids back to school, make our teachers safer is wear your mask every single time you leave the house. Maintain that 6 feet of social distance from people who don't live in your household. Wash your hands frequently. Don't think you can cheat a virus, trick a virus, negotiate with a virus. No, don't be having parties. Don't be, thinking you're clandestine about, organizing get-togethers. You are cheating your society, the school children, the most vulnerable among us. So let's all hang on a little longer. I know it's been a horrendous year and some have suffered more than others, but we can all do our part. So please do that. Help everyone get through this together. There is light at the end of the tunnel and it's going to get better. School district and all of you, please reach out to the city in any way for anything we can do to help you out. You are a very important, integral part of our community and we want to be here for you. Thank you all for joining us today and please help me amplify the message about safety for all. Thank you again so much for your time. I am so grateful to all of you for your commitment. Thank you, thank you. And thank you, Sarah, for pulling this all
Yeah.
together.
Thank you, everyone. Great to
Thank-
see you.
Bye.
Take care, stay safe, wear your mask. Thank you. Bye-bye.